Welcome to the office, and I want to show you a few pieces of equipment that we currently use for our patients. And the first one I want you to look at is the Optos. It's a scanning laser ophthalmoscope. And what they do is they're using a special type of laser, harmless type of laser that you're able to scan the inside of your eye. The purpose of this is so that we are able to take a good look at the inside layer of the eye called the retina. A lot of time people suffering from diseases of the retina such as diabetes, retinopathy, that is, in a brief description, is bleeding inside the eye. So we want to use this machine to make sure that the retina is healthy, no bleeding, there's no abnormality. And the next one I want to show you over there is called the optical coherent tomographer. And what they do is they're using a special type of infrared light, similar to using ultrasound to check on different layers of tissue. We are using the infrared light to layer out different layers of your retina, because this machine here is able to help us to see the surface, but the other one, the tomographer, will able to help us to see different layer, kind of without taking your eye, we're able to do a cross cut of your retina, so that we're able to see whether there's any fluid trapped between different layers, or see whether there's any indications of what we call macular degeneration. The tomographer is also an important equipment for us to know how healthy your optic nerve is, because they were able to measure thickness of the nerve fibers surrounding the optic nerve in order for us to see whether there's any loss of optic nerve tissue. In the early stage of glaucoma, we'll find that people suffering from that will have some thinning of the nerve fibers surrounding the optic nerve. And this is a very important piece of equipment for us to know anyone suffering from early stage of glaucoma. This piece of equipment is called VEP, what we call visual evoked potential. What is visual evoked potential is we are checking the electricity potential between the eye and the brain. Anytime we see an image, the eye is going to excite an electricity impulse going from the eye to the brain. And this machine is going to test how fast that electricity impulse is going to reach the brain, and also how strong is the impulses. If the time is too slow or the impulses is too little, that usually meaning that we have some optic nerve disease such as glaucoma or optic nerve neuropathy, and so it can be caused by diseases, inflammation, or even sometimes injury. So it's a very important piece of equipment for us to know whether there's any delay in the electrical impulses transmit from the eye to the brain. And this equipment that you are looking at now is what we call the visual field tester. What we are trying to test is to see whether there's any problem with the peripheral vision. You will notice when you look into the bowl, there's a light at the center, and then small stimuli is going to come out from the periphery. And the patient, you can see they're using a clicker to click every time they see the light. The purpose of that is one at a time we want to know whether there's any restriction in the peripheral vision. Restriction in peripheral vision usually is an indication of certain diseases such as glaucoma. And not only that, once we initiate medication to treat glaucoma, we also want to test with time go by whether the peripheral vision is still continue to deteriorate, or we are able to control in a proper manner. So there's also a very important equipment for us to see the overall integrity of the optic nerve.